Good morning, everyone. Welcome back to Breakfast Television. This morning we're live at the HeartFit Clinic in Eau Claire Market and talking about your cardiac health. February is Heart Month. February, of course, is Heart Month. Now, heart disease is the leading cause of death for women, which I think is a surprise for most. People think of that as possibly a man's disease. So let's talk a little bit about the risk factors. What are the risk factors for women?
The risk factors are still the same. Of course, with diabetes, kidney disease, leading to kidney disease, or even heart disease, hypertension, high cholesterol, obesity or overweight or increased waist girth, physical inactivity, and stress. Those are all the common risk factors of heart disease.
Okay, so what are the things that I need to be looking for, and how early should I be looking for the signs?
I think it's important to know your numbers and know your risk. Ignorance is not bliss in this case, and ignorance can lead to creating disease. So it's important to know your numbers and know your risk and start early. If you're over 45 years old as a woman, start to know your risk factors and understand them. I think that's the biggest key, is to know your risk.
Okay, know your risk factors. Should we get to work here? I'm going to get a little, I did this last year. We did a bunch of testing here last year, and you still have my file here open. So let's get, this is the first step, right, is blood pressure?
Yeah, what we do here at the HeartFit Clinic is we do a comprehensive assessment, which is done with our nurses, and we do all the risk factors and find out where your risk is, and that includes the carotid INT as part of our comprehensive screening assessment.
Okay.
And then we have the results phase, in where we actually see the changes and reduce or even reverse your risk of heart disease, and that's done with our clinically supervised exercise programs, nutrition, and stress management counseling,
right,
which includes the cardiac yoga that we just added to our repertoire as of earlier last year. So,
okay,
yeah.
And we're going to be doing some cardiac yoga a little bit later. But you mentioned heart disease. What should women do to protect themselves against heart disease?
Once again, it's important to know where you are and what your risk is. So definitely visit your healthcare professional and understand your risk factors.
Yeah.
So understand, is hypertension a risk factor to you? A lot of people go undiagnosed. I believe 20% of people are walking around with a super high blood pressure and don't even know about it.
Yeah.
So it's important to know where you are and what your risk is.
Yeah.
Diabetes being a huge risk factor for heart disease, especially with women, because it seems to attack women a little bit greater than it does in men. And women are more likely to get hypertension. So those are common risk factors. And women have a tendency to pay attention to everyone else around themselves rather than themselves specifically. So a lot of the risk factors will be overlooked or even completely misdiagnosed altogether, just because, you know, it's overlooked completely. So if people don't get to the problem right away, then there's a delay in treatment and delay in even diagnosing the problem.
Okay. Why are women at greater risk?
Women and men are at the same risk. I think the big theory is that if you ask most women would say that breast cancer is the #1 killer, but in fact it is heart disease and stroke.
Okay.
It continues to be the leading cause of death and will kill more women than all cancers combined. So that's the biggest thing, is that it's more awareness that, look, heart disease is the #1 killer of women, not other cancers such as breast cancer.
Okay. Once I've identified those flags that I could be at risk for heart disease, can I reverse it?
Absolutely. We've definitely seen a lot of that going on. That's the great thing that we do here, is we do find people who are at risk of heart disease and stroke, and of course with the carotid INT is the how old is your heart.
Right.
We do find people that are older than their actual chronological age. And here at the HeartFit Clinic, we definitely reverse the risk of heart disease through our clinically supervised exercise programs, nutrition counseling, and, like I said, with the stress management counseling, which also includes the cardiac yoga. So we're definitely reducing, and you can reduce and reverse your risk of heart disease. Heart disease is preventable and reversible.
There you go. That is the good news there. And we will be doing cardiac yoga a little bit later. Plus, we're going to be meeting a patient at the HeartFit Clinic. Still ahead on BT, guys.
All right, Jill Belland at the HeartFit Clinic.